Hi everyone, my name is Nick Potenzini. I am an occupational therapist and a graduate from Akron's Exercise Science program in 2009, and then I graduated again in 2011 from Akron with my master's in exercise phys. I was also a graduate assistant while I was there. I started OT school actually after I got my master's in ex phys, and I finished OT school from Duquesne University in Pittsburgh in 2014. And I've been a therapist for about 6 years now. So right now, I currently work at Akron City Hospital. We are going through the COVID pandemic, and I've been seeing coronavirus patients on and off for the past couple of weeks, helping them recover from their respiratory illness. I also do outpatient therapy here. When I do outpatient, I focus mostly on upper extremity orthopedics. So I do a lot of hand therapy, all the way up to shoulders and shoulder replacements and rotator cuff repairs and stuff like that. So any kind of orthopedic injury of the upper extremity is what I specialize in. I have teaching experience as well. I taught at the University of Akron even after I finished occupational therapy school. I taught for 2 years. I taught fundamentals of strength and conditioning. I taught that on Monday and Tuesday nights up until a few years ago. So I really enjoyed my time at Akron U, and I think a lot of the classes in the exercise physiology department kind of paved the way for my career, especially in terms of courses like biomechanics. A lot of the labs were very helpful, learning how to use different equipment and kind of getting a jump start on testing people, whether it was muscular strength or flexibility. Being able to do blood pressures and EKGs have all been extremely helpful and valuable in my career. So, but as of right now, day to day in the hospital, I see a wide variety of things. Not just the COVID patients that I talked about earlier, but I also see open heart patients. I work a lot on the neurotrauma ICU floors with stroke patients and trauma patients. We do a lot of work with orthopedics, even in the hospital, with total joint repairs, orthopedic trauma, things like that. So I'm kind of all over the place, and as an occupational therapist, my main goal is to work with people to gain their independence back. I focus on a lot of the functional tasks that people need to do day to day. So, like I said, I've been here for about 6 years, and everything's going good, and everyone right now is just trying to stay safe. So, hopefully everything is going okay with a lot of the distance learning that you guys are doing. And if you guys have any other questions about things that I do, or tips on trying to get into therapy school or whatnot. So if you have any questions about that kind of stuff, Laura can give you my contact information, especially if you're interested in getting into OT or looking at OT schools. I really enjoy helping students with that kind of stuff. So again, I'm an OT. I've been in OT for 6 years. I've taught exercise science at Akron before and strength and conditioning. So you guys are in a good program that'll set you up for a good future. So thanks a lot.